have prostate cancer, it's not a death sentence. It's good to get a lot of second opinions and know exactly what options you have. When it comes to surgery, a lot of times we used to do open surgery, and open surgery was a little difficult because it involves a big incision. We used our hands, or what we call tactile feedback, to do the operation. And because you worked in a pool of blood, it was difficult to really do a good nerve sparing, and as a result, sexual dysfunction and incontinence was a big problem. Over the last 15 years or so, we've gone from open surgery to laparoscopic surgery and then to robotic surgery. And I think these robotic surgery in the hands of experienced surgeon, and that's where it's the key. You need to have an experienced surgeon behind these robots to be able to do a good operation for you, good nerve sparing. And a lot of you have read about this smart technique that we have at Lennox Hill that I perform. This has to do with the fact that instead of moving the nerves away from the prostate, like the traditional nerve sparing, I do the exact opposite. I move the prostate away from the nerves. So it really minimizes any damage to the surrounding tissues, save your nerves, so you have about 75 to 80% chance of sexual function, and you have 95% chance of continence. And what's important about surgery is that moving forward, your PSA should always be 0. You're always going to be in control. And if the cancer ever comes back after surgery, that's when we can do radiation. I think today, with the way we're doing these surgeries, that's the standard of care. And I would use radiation as a backup plan as opposed to do it in as a primary treatment. Now, of course, case by case is different. If I see a 78-year-old man with a moderate risk prostate cancer, I may offer him radiation because I think at that point surgery may be a little difficult for him. I just saw an 81-year-old with a low-risk prostate cancer. I may do watchful waiting. But when it comes to younger men, 50s, 40s, 60s, whether it's moderate risk or low risk or aggressive, surgery, I think, has definitely a major advantage.